Infant falls can cause injuries ranging from cuts, bumps, or bruises to a skull fracture or brain bleed requiring immediate emergency care. Even when the injuries are minor, an infant fall is a truly terrifying experience for the baby, their parents, and other caregivers. Although most infant falls don't cause permanent injury, about 1 in 4 will require additional testing. That's why all falls need to be reported. If your newborn falls in the hospital, notify the nursing staff right away. If your infant falls at home and shows any signs of head trauma, call 911 immediately. If there are no signs of an injury and your little one is acting normally, report the fall to their healthcare provider as soon as possible. Here are 3 important facts to remember. 1. The biggest risk to a newborn falling or being dropped is a tired parent. 2. Anywhere from 50 to 100% of infant falls happen during nighttime feedings. And 3. Even infants who can't roll over can still slip off a bed, chair, or other surface. Understanding the risks and taking precautions can help prevent infant falls both in the hospital and at home. According to estimates, anywhere from 600 to 1,600 infants fall or are accidentally dropped in U.S. hospitals every year. Some of the factors that may contribute to these accidental falls include the health of the new parent. For example, if you're overtired, receiving narcotics for pain relief, have a low blood count that could cause you to pass out, feel weakness or numbness in your legs after an epidural, or misuse a controlled substance. The hospital environment, including how your hospital room is lit at night, the height of the hospital bed, or tripping over items like an IV pole or cord lying between your hospital bed and the baby's crib. Always use a crib to move your baby from the nursery to your room and while you're walking in the halls. Caring for your new baby means not getting enough sleep and feeling exhausted most of the time. And it's even harder to rest when you're getting up to feed every few hours, around the clock. In fact, breastfeeding causes your body to release the feel-good hormone oxytocin, which may cause you to feel even more relaxed and sleepy during feedings. Because falling asleep could cause the baby to slip from your arms, it's important to recognize how tired you are before starting a feeding session. If there's any chance you might fall asleep while feeding your baby, here are some ways to lower the risk. First, don't feed your baby on a couch or armchair where the baby could become trapped and unable to breathe. Second, have someone nearby to help you stay awake or pick up the baby if you do fall asleep. Third, if you're feeding by yourself, set a timer to go off every few minutes to help you stay alert. And put your baby back in their crib as soon as you've finished feeding them. Here are some other ways to minimize the risk of an infant fall. Closely supervise when a younger sibling wants to hold the new baby. Never leave your baby alone on a changing table or other high surface. And always strap your baby securely into their carrier, swing, stroller, or other device. Being aware of potential risks and minimizing the chances that your new baby will slip off a surface or fall from your arms is very important. If you have any questions about protecting your little one in the first few weeks and months of life, talk with your nurse or the baby's healthcare provider.